ba2.12.1. I think I have that right, but it's here. And it accounts for about 58% of all new U.S. cases. Health officials say there is no evidence it causes more severe illnesses than earlier versions. But looking at the big picture, there have been nearly 84 million COVID cases in the U.S., with more than 767,000 infections in just the last 7 days, totaling death toll now topping 1 million people. Let's bring in Fox News contributor Dr. Jeanette Neshelwatch. So you knew this was coming, Dr. J. What's the reason for the rise in COVID cases?
Yeah, Arthel, I'm not surprised. We're going to probably continue to see spikes and surges, then it'll level off, and we'll probably see it again in the fall or in the winter. And I think this is for two reasons. Number one, human behavior, the environment. We're living our lives. We're doing what we should be doing. And then, of course, viruses naturally mutate. So that's why it's so important to do what you can do, which we all know what to do to protect ourselves, to make sure you're at the lowest risk possible. But yes, here in New York, this sub-variant accounts for about 90% of the current cases that we're seeing. But it's, even though it's more contagious, it spreads more readily. With my patients, I'm not seeing that the symptoms are more severe. And, you know, for example, today, Arthel, I only had about 4 cases, and everyone, their symptoms were very, very mild. So that's actually a good thing.
That is a good thing. I'm going to come back to that in a second. But referring to wearing masks, White House COVID-19 coordinator Dr. Ashish Jha recently told ABC's This Week, he says, quote, "I feel that very strongly that in crowded indoor spaces and places with high transmission, people should be doing that." So I ask you, how much does relaxed mask mandates factor into this current rise in COVID cases in our country?
Well, it depends on what type of mask you're wearing. You know, if you're wearing an N95 mask or KN95 mask, that will give you a lot of protection. But if you're wearing a loose surgical mask, you know, that may not offer as much protection. And it also makes a difference on your risk factors. So if you are indoors and it is truly crowded and you're a high-risk individual, and of course it makes sense to protect yourself, but if it's not a high-quality mask, it may not really be that much of a benefit for you. That's why it's important to not just look at one aspect of protection, such as the mask, but making sure that you're vaccinated as well with your booster if you're eligible for that.
And then also, you have to wear the mask correctly. It has to cover your nose and mouth.
That's right.
I don't get that. It drives me nuts when I see that. But you know, Dr. Jeanette, by now, most people expect to get COVID if they haven't already, and they are no longer afraid of it, because getting COVID does not mean you're going to die. I mean, is that the right attitude or the right way to look at this?
You know, I think we've made such tremendous progress over the past 2 years. I don't think we should be fearful or panic or be afraid, you know, of acquiring this virus. If you haven't already had it, you are in the minority. Even I dodged it for 2 years, and then finally it even got me. But I think it's important to understand we've come such a long way. We have antivirals. You know, one of my patients today who tested positive, he was a senior citizen, no problem, sent him over to the hospital to get monoclonal antibodies. Another patient had diabetes, no problem, was able to prescribe him Paxlovid antiviral. So we're in a different place right now, and I feel like we have control over it. And it's no longer the nightmare that it was at the beginning of the pandemic or just over the holiday season recently when we first dealt with Omicron. It was a disaster. But right now, absolutely not. Just do the basics. Get back to the basics of remembering how to protect yourself, especially if you don't have natural immunity. Then you can get vaccine immunity along with your booster, and just know your risk. That's all you should be doing right now.
And finally, meanwhile, nationally, there has been a 28% increase of COVID infections. This is over the past 2 weeks. More than 100,000 new confirmed cases since February. And many infections are not reported, as you well know, and documented, so that number could be higher. But meanwhile, yes, COVID is a novel virus. How much is known about long COVID?
Yeah, so we're now about 2.5 years